You know the feeling, right? You're standing in the dental aisle, just staring at this giant wall of colorful bottles. They're all promising a healthier smile. And yeah, it's a staple in our daily routine. But do we really get what mouthwash is supposed to do?
I mean, let's be honest. For most of us, it's just a quick fix, isn't it? That minty blast to cover up the morning coffee or, the garlic from lunch. It's basically a temporary fix for bad breath.
But what if it's way more than that? What if that bottle you pick could be a seriously powerful tool for preventing cavities, fighting off gum disease, and just leveling up your entire oral hygiene game? Well, that's exactly what we're going to dig into.
Okay, so let's talk about the real benefits of mouthwash. The stuff that goes way beyond just that minty fresh feeling.
So yeah, freshening your breath is a big one because it kills those odor-causing bacteria, but a good mouthwash does so much more. Some have antibacterial formulas that actually reduce plaque and fight gingivitis. That's just a fancy word for early-stage gum disease. Others have fluoride to help strengthen your tooth enamel and stop cavities in their tracks. And some can even soothe irritated tissues in your mouth. But here's the key takeaway, the big aha moment. Mouthwash gets into all the nooks and crannies that your brush and floss just can't reach. It's like a final all-over clean.
Okay, so with all these different benefits, how in the world do you choose the right one? I get it. That wall of colorful bottles is intimidating. But trust me, it gets a whole lot simpler once you understand the main types. All right, let's break this down. You've got a few main players here. First up, cosmetic rinses. Think of these as your basic breath fresheners. Then you have therapeutic rinses, which are more specialized. They're for treating things like gum issues. Fluoride rinses are pretty self-explanatory. Their whole job is to prevent cavities. Now, antiseptic rinses, these are the heavy hitters. They use ingredients like chlorhexidine, which is this powerful disinfectant that basically messes up the bacterial cell walls, or they might use essential oils to really kill off the bad bacteria. And finally, you've got your alcohol-free rinses, which give you a nice, gentle clean. Absolutely perfect if you have a sensitive mouth.
So you've picked your bottle. Great. But just grabbing it and doing a quick swish isn't going to cut it. Nope. If you want to get all those benefits we just talked about, your technique is absolutely crucial.
Okay, so for the best results, you gotta follow these 5 steps. First, always brush and floss before you rinse. Get all that debris out of the way. Second, measure the right amount. Usually it's around 20 or 30 milliliters. Third, swish it around vigorously for a good 30 to 60 seconds. Really make sure it gets everywhere. Fourth, spit it out. Please don't swallow it. And fifth, and this is super important, wait at least 30 minutes before you eat or drink anything. You've got to give those active ingredients time to actually work their magic.
All right. Let's connect all the dots now. We know the different types, and we know how to use it correctly. So how do you pick the perfect rinse for you and your specific needs?
Okay, so if your main concern is just bad breath, maybe you have a big meeting or a date coming up, a simple cosmetic rinse is perfect. It's a quick, easy fix that gives you that minty, clean feeling right when you need it most.
What if your concern is bleeding gums? You see a little pink in the sink when you brush? That could be a sign of gingivitis, which is basically gum inflammation. In that case, an antiseptic rinse is going to be your best friend. It's specifically designed to kill the bacteria along your gum line that are causing all that irritation.
Now, what if you're dealing with a dry mouth? Well, a standard mouthwash could actually make things worse because alcohol is really drying. So you're going to want an alcohol-free formula. They often have soothing things in them like aloe vera, and they'll give you a great, gentle clean without that sting or extra irritation.
And if cavities are your big worry, then a fluoride rinse is essential, no question. Its whole purpose is to remineralize your tooth enamel. All that means is it helps put back the lost minerals, making your teeth stronger and way more resistant to the decay that's caused by acids and sugars.
Finally, what if you have sensitive teeth? Oh man, the last thing you want is some harsh, stinging rinse, right? So you'll want to look for formulas that are specifically labeled gentle and, you guessed it, always alcohol-free. They still clean effectively, but without all that unnecessary ouch factor.
Okay, we've covered a ton of ground, but I'm sure you still have some questions floating around. So let's do a quick fire round and tackle some of the most common ones I hear.
All right, here's the #1 question, for sure. Do I really need mouthwash if I'm already brushing and flossing? Like, is it just an extra, maybe a necessary step? The short answer is it's not strictly required, but it is incredibly helpful. Think of it like this. It's a liquid tool that cleans all the surfaces your brush and floss can't. We're talking your cheeks, the roof of your mouth, and just below the gum line. So yeah, it's a really valuable supplement to your routine.
Okay, next question. Is alcohol-free mouthwash actually effective? I know, a lot of us grew up thinking that intense burning feeling meant it was working, right? So does a gentler version without alcohol actually do the job?
100% yes, it's absolutely effective. See, the alcohol in old-school mouthwash is mainly just a solvent and a preservative. It's not the main cleaning ingredient. The antibacterial agents in the alcohol-free formulas are just as good at killing germs, but they do it while being way gentler on the tissues in your mouth.
And now for the big one. Can mouthwash permanently cure bad breath? Can you just swish your way to forever fresh breath and call it a day?
Unfortunately, the answer here is no. Look, mouthwash is fantastic for managing bad breath, but it isn't a cure. If you have bad breath that just won't go away, it's usually a symptom of a deeper issue, like a cavity or gum disease, and that's something you really need to see a dentist about.
So if there's one thing you take away from all of this, let it be this. Mouthwash is a powerful complement to your oral care routine, but it is never, ever a replacement for brushing and flossing. Think of it as a fantastic supporting actor, but brushing and flossing, they're the stars of the show.
So the next time you find yourself standing in that dental aisle, you'll actually have the knowledge to choose with confidence. The question isn't, should I use mouthwash anymore? Now the question is, which mouthwash is the right strategic addition for my health? And hey, for the absolute best answer for you personally, a chat with your dentist is always the best next step.